Go.
Hi, my name is Itzel and I am doing the IV insertion and removal video. So first I would start with knocking on the door, introducing myself. Hey Mrs. Smith, I'm here because I have a doctor's order to give you medications through an IV. First I'll wash my hands and put on my gloves. What is your name and date of birth? I would match it up. Then I'll say, is there any reason or which arm do you want me to use? And then she'll say her left. And then I'll ask, is there any reason at all why I won't be able to use this one? Like if you had any lymph nodes removed or anything like that? No? Okay. So we're just going to inspect where we want it. We're going to go from distal to proximal, seeing where we want to insert it. And I think I'm going to do it on the interior of the hand. I'm first going to start by prepping my supplies. I have the IV kit as well with my 20 gauge needle, and then it comes with the 10 gram, and then this alcohol prep with the, and then I have the J-lube, and then the little cap. So we're going to pull down and push back just to ensure that there's no air bubbles. Got it. Then we are going to secure it. Okay. We're going to flush it. And it is flushed. Set it to the side. Okay. We are going to clean it, clean the area, clean. We never want to blow dry or anything like that. We want to just let it sit and disinfect by itself. We are going to put this 4 to 6 inches above the insertion site. Get it nice and tight. Okay, once you got that settled on, are you doing okay? She's doing fine. We are going to insert our needle. Gonna go up. We have blood in the chamber. I'm gonna push it in. Okay, then this is when we are going to secure it. Okay, we are going to push about 5 milliliters of the medicine. Do you feel anything? Oh, you're feeling salt. Okay, you're tasting salt. Okay, that means we are in the right spot. So, okay. Dispose of the needle. Okay, we are going to close it. Take it off. And close it. We're gonna do that. Okay, we got that ready. We have 10 gram. Place it right there. Okay. There we go. Are you doing okay? She's doing fine. No pain, anything? Okay. I'm gonna use this tape provided. And tape provided to secure. And we're gonna put our cap right on. Okay, just so that no type of infection gets in or anything like that. Okay, I would clean my area before leaving. I'm just gonna set this to the side for now, but it is clean. Okay, and that is how you insert it. What I would document is the time and date. In the documentation, I would document where the site of infection, where the site of the IV is, so the anterior part of the hand. I would insert how many attempts, and I would say 1. I would document why we did the IV, which is for IV medication, and I would document what type of needle we use. So I would say like 20 gauge, 1 inch. Then I would document if there was any pain or redness or anything like that. She was fine, so I would say she tolerated it well. I would document that we have the IV line secure and that it was flushed good. It was nice and flushed. And I would educate the patient about patient safety. I would educate the patient about if anything were to go wrong, like if there's any redness or swelling or pain, just to let me know, and then I would let them know, that the call light is in their hand, that the bed is lowered, that the rails are lifted, and that the bed is locked, so that I ensure patient safety. And I would let her know if she needs anything, that she can just call me and we would get her taken care of. That's what I would document. So now for the IV removal, we are gonna have our little gauze or cotton ball, whatever. Then our tape, we're gonna get this ready. We're gonna set that to the side. We have our tape, our gauze, and then we're ready to begin. So I would identify myself. Hi, Mrs. Smith, I have in order to take out your IV. I would identify the patient with her name and date of birth. I would say that I'm with the WT nursing department, so now I have a doctor's order. So first I am going to take off the tape. Okay. And then I will pull the tetragram just a little proximal, just so that I'm not taking the catheter or anything like that out, because that can be painful and bad. And I'm gonna have my gauze ready, and I'll clean up if there's any bleeding or anything like that. Might hurt a little bit, I'm sorry. Okay, just like that. Hold it intact. Pull. And then I will put the gauze and then take it out. The catheter is intact. Set that aside. And I will put the tape. Tape on, and I would let her know that if she experiences any pain, swelling, to just come back and let us know. I would ensure patient safety by lowering the bed, make sure that the wheels are locked, the call light is in her hand, and that the rails are lifted too. I would document that I had an order to take out her IV because she was doing well, and I will document the time and date, that she tolerated it well, and that there was no redness or swelling or anything like that. I think that's it. And then I would make sure if she needed anything, like the 4 P's, like the pain, if she's in pain, I will see that, document that. And I would just see if she needed to go to the restroom, make sure she had everything that she needed, and that she was in the position that was most comfortable. But other than that, that's all I would document. Thank you.